We're going to run through the 10 ways to stop bad breath for good, according to GQ magazine. Okay, 10 things you can do. Number 1, brush often, floss nightly. That's pretty,
that's standard.
Nothing wrong with that.
Yes,
and the Dr. Nabors solution would be, if you want a healthy mouth and do everything you can to protect yourself from periodontal disease,
I would irrigate with a water pick to get more oxygen beneath the level of the tissue as opposed to just between the teeth. So that's an extra step, but I realized that the whole key is about bacteria control. So brushing, of course, flossing, of course. If you can add irrigating or water picking to that, then that's a home run.
Got it. Okay. Number 2 is stay hydrated. The advice here is that, like many other functions of the body, that your breath is no different. The drier your mouth, the more stinky things get, thanks to those sulfurous bacteria. Okay, now here's the advice, Dr. Nabors. You can weigh in on this. Speaking of morning bad breath, here's the strategy for waking up for kissable bad breath. Drink a glass of water before bed.
There's a lot of hype in this statement. Of course, hydration is great for your body, period. We all know that. And so anything that helps your body stay hydrated is going to help you be healthier regardless. And so I think that's kind of a generic let's stay hydrated. But as far as controlling microorganisms in terms of, if you've got chronic dry mouth, then you've got a different type of problem, right? That's something that you might need to see a physician about because our natural saliva, our natural salivary glands should do a pretty decent job of keeping your mouth hydrated. So if you're chronically dry mouth situated, that could be related to a medication. It could be related to something else. And so if you're dealing with that, it's going to take more investigation than a glass of water before you go to bed.
Okay, number 3, choose better gum. So the advice is pick a sugar-free gum and one that uses cinnamon or xylitol.
Right.
True or false, your advice would be?
Well, there's some truth in it, and I think that's probably true in all of this. The truth in it is that gum stimulates salivary flow. So stimulating salivary flow is a natural antibacterial. I mean, saliva is a natural protectant for the mouth and the teeth. So if you stimulate it, that's a good thing. Chewing gum on a regular basis, not good for your TMJ. So your jaw, your joints, we can overuse those joints with gum. And so I would not recommend chewing gum as an alternative to a dry mouth to stop bacteria. I think the risk outweighs the reward there. Yep. The other truth in that, though, is there are natural antimicrobial products, essential oils being one of them being cinnamon. So there is some truth in the essential oil side of that and the xylitol.
Got it. Okay, number 4, swap your toothbrush quarterly. This one they're blaming on the ADA, saying that the ADA recommends.
With that. At home, in our home, if someone gets sick, then we throw the toothbrush away. Right. So, I mean, it's just some common sense there. But I think changing it on a regular basis isn't so much from bacteria, but also wear and tear, and you wear these things out. So occasionally, re-upping them into new ones is great.
All right, number 5, upgrade your toothpaste. We're back to zinc here. Whoever wrote this article is hot on zinc salts. Yeah. Right. So your recommendation for toothpaste would be?
Well, I'm more concerned about fluoride than I would be about zinc. Fluoride, again, a natural protectant for teeth. And so some of them, all natural products are good and they do have essential oils, but having that fluoride on a regular basis to me is a much more important factor than whether or not I'm controlling bad breath. because the products that are going to be in your ADA approved toothpaste, your Ames, your Crest, your basic toothpaste is what I recommend. Nothing whitening, nothing tartar control, just basic fluoridated toothpaste.
You got it. Okay, number 6, try a tongue scraper.
I think that's a great thing. It's another step. And I think as a society, the more steps we give people, sometimes what is it? Paralysis with too much information. I forgot the statement, you know, probably what I'm talking about, but yeah. Doing that, obviously there's plaque that accumulates on the tongue, on the taste buds. And so definitely using a tongue scraper is a good product.
Okay. Number 7, use mouthwash.
Like it.
And the recommendation here is pick an alcohol-free option. Again, it's back on the whole dehydration thing.
There's some truth in that. You know, when you're if you're going to use a mouthwash, use one that's alcohol-free. Alcohol is a drying agent, which is interesting, but they don't talk about that when consuming alcohol, you know? So it's like any alcohol, you know, is going to be a drying agent.
Got it. So your preference, alcohol-free mouthwash would be?
Well, I mean, most of your products now are going to have an alcohol-free option. You're just going to need to look at the back on the list of the ingredients. If the first ingredient says alcohol, then don't do that. But most of them will have and say on the front, alcohol-free.
Got it. Okay. Number 8, alter your diet. And the recommendation here is obviously garlic and onions. You want to avoid those. But then it also says minimize the ingestion of anything that dehydrates the body, like caffeine, alcohol, parches the mouth. They're really into dehydration in this whole deal.
Well, I mean, you know, that's just one of those things that we all would have to agree is kind of a universal truth, that hydration is good for your body. Underhydration, not good, but overhydration is as well. You know, I mean, I think we're all kind of into the water kick and we understand those kind of things, but there's a balance that you have to have even in hydration. So I forgot what the question even was.
No, it's just talking about alter your diet.
Yeah. I mean, you know, definitely everything should be used in moderation, you know, and so when we're talking about hydration, if you're talking about alcohol, if you're talking about mouthwash, if you're talking about irrigation, there's a moderation factor that you have to look in all of that.
Got it. Okay, number 9, see the dentist twice yearly.
Well, duh, of course. Yeah, another universal truth.
And I would say if we have 80% of the population that has some form of periodontal disease and bacteria recolonizes every 90 days, that the overall recommendation should be that most of America should be seeing the dentist
more regularly, every 3 to 4 months, you know, honestly. And so we have several physicians here in our practice that now come once a month. You know, it's really? Right. Bacteria control, I think, is at the heart of this article. I mean, controlling microbiology, and the better job that we do of that as a human being, typically the less that we're going to be sick.
You got it. And then number 10, keep your oral hardware clean. Which is, you know, obviously a good idea. Any suggestions on that one for toothbrush, everything else you're using? What's the best way to keep it clean and sterilized?
Well, I mean, there's the UV products now that you can keep your toothpaste in. I think those are good. Most of your oral health products are going to have an antimicrobial component to them. So if your toothpaste has fluoride, a natural antimicrobial, so just typically washing and rinsing on a regular basis. Your appliances like your mouth, your retainers, your clear liners, things like that, all of those do need to be clean. Water itself, from a mouth bacteria standpoint, is a natural antimicrobial. So we have to understand that the bacteria of the mouth are subject to water as an antimicrobial. So the bad bacteria, cleaning with water, washing with toothpaste, those kind of things, I don't really think that you have to use anything special, but the new UV products are nice.
Perfect. All right. There's your top 10. They should have come to you, Dr. Nabors.
Yeah, I don't know. We're not selling anything. So,
and the fact they dedicated an entire article to, you know, bad breath is good news for dentistry. And absolutely. You might want to share with your patients as well as your take on those things. We'll include a link to the article with this video, so you can have all the up-to-date information that's in the popular press today on what people are saying about dentistry. Thanks, Dr. Nabors, for your expert opinion.
Thank you, Steve.
And all of our dates, locations for upcoming No More Hygiene are also included with this video link below, where you can have the comprehensive approach to what we call modular periodontal therapy to cure disease, save lives, and grow your practice. Thanks, Dr. Nabors.
Yeah, thanks, Steve.